In this video we're going to be reviewing Candida albicans. So what is it? It's a superficial fungal infection that occurs on either the skin or mucous membranes. It's often referred to as a yeast infection, and when it occurs into a mouth it can be referred to as thrush. Where does it occur? Well, common areas include, as we discussed, mucous membranes of the mouth, perineum, vagina, axilla, and under the breast. Risk factors for contraction include immunosuppression, because if the body's not able to fight off this fungus, the fungus is allowed to thrive. This is also related to AIDS and chemo patients, as well as long-term antibiotic treatments. Another risk factor is diabetes mellitus. Final risk factor is obesity. Part of the fact that obesity is a risk factor includes the fact that there's increased surface area in skin folds that can allow this fungal infection to grow. So from a nursing perspective, the assessment is going to consist of primarily inspection. You're going to want to examine the skin for redness, irritation, itching, and other stings or discomfort. And you're going to want to check the mucous membranes for red and white spots or patches. Inspecting the skin is often extremely important in patients who are elderly, obese, and cannot care for themselves. You're going to want to make sure to thoroughly inspect any skin folds. And inspecting mucous membranes is very common in labor and delivery, when babies can be born with Candida albicans in either the membranes of the eyes or the mucous membranes of the mouth. So there are several nursing interventions to keep in mind. The first is to teach the client to keep the skin folds clean and dry so this fungus does not have the opportunity to grow. For patients who are not able to fully care for themselves, it's important to inspect the skin folds for the patients, reposition the client, and to keep bed linens clean and dry so this fungal infection does not have the opportunity to grow. Another intervention is to provide frequent mouth care in order to help reduce or prevent this fungal infection from thriving in the mouth. And it's also important to avoid any irritating products that can irritate the mouth while a person has this fungal infection. Another intervention is to not provide foods that are too hot. And as always, it is important to use antifungal medication as prescribed by the physician.